From KBIA and the Reynolds Journalism Institute, on air and online, this is Intersection.
Hello and welcome to Intersection, where people and ideas meet online and on KBIA. I'm Ryan from Muehlner. Today you're listening to a special edition of Intersection from Leadership Auditorium on the University of Missouri campus. Later in the show, our live audience will join in on today's conversation and conversation about how to talk to your doc. The way a patient communicates with their doctor can have a significant impact on diagnosis, treatment options, the ability to avoid medical errors, and ultimately an impact on a patient's health. Today on Intersection, we're joined by two doctors who are board members for Health Literacy Missouri, a nonprofit organization that strives to help people make good decisions. Dr. Steve Pugh is medical director of the Wound Care and Hyperbaric Center at Twin Rivers Regional Medical Center in Kennett, Missouri. He served on the board of directors for the Missouri Foundation for Health from 2002 to 2008 and has been chair of the board for Health Literacy Missouri since 2009. Dr. Pugh, welcome to Intersection.
Thank you, Ryan.
And Dr. Ingrid Taylor is a board-certified family practice physician based in St. Louis. Dr. Taylor is also president and CEO of Allies in Healthcare, LLC, a health information company, and Allies in Healthcare Publishing. She's been on the board of directors of Health Literacy Missouri since 2009. Dr. Taylor, thanks for joining us.
Thank you.
And for you and our listening audience, this live forum was pre-recorded, so we won't be taking calls this week, but you can share your comments or watch the video of this week's show at kbia.org. Okay, so to get started, the concept of health literacy might be something that our audience, some of our audience may not be familiar with. What are we talking about when we talk about health literacy?
Well, basically with health literacy, we're talking about a patient's or people's ability to be able to obtain, process, and actually utilize health information in a way that they make better decisions about their health. It has been a much unrecognized problem in healthcare for the past several years, and it's just now coming into prominence. We are moving into a healthcare system where we're trying to be, quote, patient-centered, where patients have a more active role in their decisions, but how can we make them more, how can we help them make better decisions? How can we truly empower them if they don't really understand what they're making decisions about? And that's what health literacy is all about, is helping people understand their health, what affects their health, and ultimately to help them make better decisions about their health.
And we're not necessarily saying, I mean, everyone out there is not going to be a doctor, right? Everyone's going to go to school, learn about this stuff. I mean, there are some smaller things people can do to help really become familiar with their specific health issues and concerns and those issues. Yeah.
Absolutely. You know, we're in the stage of technology now. I mean, the internet, whatever, there's a wealth of information on the internet. But ultimately, the foundation of all health decisions and all communications is with the doctor, patient, and how they communicate and how they are able to interact, how they build that relationship of trust to empower patients actually to make better decisions.
And I just want to piggyback on some things. And first of all, with the term literacy, most people equate that with educational level. And so if someone may not have gone to high school or college or graduate school, they would term what their ability would be. But people need to understand, even with a PhD or an MD, if you're in a crisis, your literacy level goes down. And your ability to comprehend your illness, the consequences of an action or non-action, markedly changes. So it's not based on your educational level. It's not based on your ability to read very complex literature. It's really your ability to understand your health condition, what you need to do about it, the consequences of that, and to make a decision that is in your best health interest. And it also is improving your relationship with your doctor so that you can verbalize obstacles that keep you from championing an action plan. And so anything that physicians can do to clearly speak in terms a patient understands is helpful, but it's also helpful for the physician to hear from the patient on reasons why this particular action plan does not work for them. Because there are many ways to get home, and there are many ways to solve a health problem. And Our job is to empower patients to recognize they have some rights and they have ability to ask questions and they have the ability to find the plan that works best for them.
What are some of the reasons that patients won't ask those questions or won't pursue those other options when a doctor's giving them a diagnosis or prescribing them a medicine?
Well, I think the first reason is the thought that the patient feels, well, I should understand this. Well, no, if a doctor is speaking in terms you don't understand, it's your health. It's your ability. And most people, if they don't understand it, guess what happens? They just don't do it. That doesn't necessarily mean not doing the action plan is in your best interest. It just means that you didn't get enough information to feel comfortable with moving forward. But the doctor is not Dr. Spot. I mean, we don't know what the issues are that keep you from not, being compliant. And hopefully the tools that we can give you or the empowerment that we can encourage you to have will allow you to say, I don't want to do this because I'm concerned it's going to make me feel pain or it's too expensive, or is there another way I can do that that's less taxing on me? And to speak up, and I'm sure a plan can be worked out.
Yeah, I agree 100% with Ingrid, and I think the conversation between doctor and patient, the doctor is in charge of this conversation, and it always has been. And
That's a perception anyway?
That is a perception. And, I think physicians these days have to grasp that opportunity to basically, change the roles a little bit, where patients are actually empowered to ask questions. People are allowed to ask, what are my options? What else can I do? And whatever. And this is in the doctor's office or in the hospital. There's something that we've done down at Twin Rivers for inpatients that what we try to do is you try to set the table from the very beginning that it's a relationship based on we want to do what's best for you. We want to care for you. And we developed a concept in Kennett called the sacred moment, where when a patient first comes into the hospital, the first 10 or 15 minutes is spent by a healthcare provider going into the room, not talking about, do you have a living will, what are your allergies? It's talking about what are your greatest fears and concerns? What are the things that are going to impair you from getting well or focusing on getting well? And it's the same way in the doctor's office. I think the doctor has to set the table right to let them know that, yes, you're part of this as much as I am. I may lead the conversation because I went to school and I have the basic knowledge, but it has to be a two-way street. But I think physicians these days really, really need to work on that and try to empower people to actually ask questions, to interact, ask for options, and whatever, because we're happy to do it, but what happens, they never ask us. And so I think it's incumbent on us to bring it out of them.
Is the time that a patient has with the doctor, the amount of time, a challenge too? I mean, lots of people I'm sure have been to doctors and seems like you're waiting for a while, you have them for a couple minutes and they're out to the next patient, right?
Yeah, I think nowadays, right now, we're moving into the age of electronic medical records. And I think eventually in time, once we get past the learning curve, it actually is going to be a very nice, efficient way for us to interact with patients. But right now, that's one of the barriers that keeps us from probably spending as much time as we could with patients. The other thing is the system of medicine that we have. We're basically paying by volume. The more patients you see, the more money you make. We need to go to a system, and we are evolving into a system where we as physicians are going to be paid more based on outcomes rather than how many patients we can see. I think when we do that, I think we will eventually evolve into a situation where spending quality time with patients and letting them know that you're concerned, letting them know that you care, I think all those things are going to be possible again.
I also think that the more the patient is prepared for the visit, the more productive the visit will come. Before I open the door to see a patient, I have already looked over their records. I have already reviewed the consultation. I have already reviewed the labs. And before I even open the door, I have an action plan in my head. So what if the patient came in and said, not only do I have these problems, but they could show me when those problems occurred. If they're having problems taking their medication for whatever reason, they don't like how it tastes, it's difficult to swallow, it makes them nauseated, it makes them go to the bathroom too frequently, they are prepared to tell me those things. In addition, when they come with their questions, what if they had on the same piece of paper the answers to those questions? On the same piece of paper, so that you have your questions on this side and then you have your answers on that side. And then if they saw a specialist before they saw me as a family physician, what if they had prepared for me what medicines were changed, the doses that were changed, what the plans were with the specialist, if any lab tests or studies were done, if they had them physically with them at the time of the visit? It makes the interaction so much more productive, which led for me to actually do the planner that I have, so that at your fingertips you have your health information. So you can physically show it to the doctor, you can verbalize it to the doctor. If you feel that the doctor is not understanding your perspective, you can stop him and say, okay, why don't you tell me what I just said in your own words? And just saying that slows the pace down a little bit, and it helps the physician to make sure he clearly understands your perspective.
Mm-hmm. And so the patient is
Right.
clearly understanding what's being told, right?
Right.
Yeah, yeah.
Right,
Yeah.
right.
I take a moment to remind our audience this is Intersection, a program of KBIA and the Reynolds Journalism Institute. I'm Ryan Famulner, and today on Intersection we're talking about how to talk to your doctor. The way a patient communicates with their doctor can have a significant impact on diagnosis, treatment options, the ability to avoid medical errors, and ultimately have an impact on the patient's health. We're joined by two practicing Missouri doctors who are also board members of Health Literacy Missouri, Dr. Steve Pooh and Dr. Ingrid Taylor. The organization's goal is to help people make smart health decisions. This is a special edition of Intersection from Leadership Auditorium on the University of Missouri campus. This live forum was pre-recorded, so we won't be taking calls this week, but later in the show, our live audience will join in on today's conversation. Today's show is produced in partnership with the KBIA Health and Wealth Desk. So you mentioned that planner that we have a copy here. What kind of, you mentioned a little bit of some of the different things that are in this, but what are some of the other techniques you use here to have people, I guess, kind of be prepared, but also take away what they need from their appointments and whatever else, whenever other doctors visit?
So the planner also has little vignettes to improve your communication. So for instance, immunizations. As an adult, you think, oh, I had my immunizations when I was a kid. But there are adult immunizations that you need to have. And so if you go through the planner, it will say, well, did you get your tetanus shot? And then you can ask your doctor, are there any other additional immunizations you need? After the age of 65, there are some other immunizations you may want to have a conversation with your doctor about. It has a small glossary in there so that when physicians use these large terms, or you're in the ER and you don't understand what they're saying, you can actually, what were they talking about? Hematuria, you said I have blood in my urine? You can translate that pretty quickly. And then I think another very important section is medications. Because when you go and see a specialist, the new specialist may order a different medication. The new specialist may increase the current medication you're on. The new specialist may stop a medication and put you on a different one. And that information may not immediately get back to the primary care physician. So this book helps you keep a track of that so that when you do go to the doctor and your medicine is changed, you can say it was changed on this date by this doctor because of this reason. And when you have an allergy to a medicine, it can be specific. It is, I have an allergy to this medicine, it does this to me. Mm-hmm. And if you're ever in crisis, you can take the red book with you and take it to the ER, and they have all that information right there. So those are wonderful parts.
How often do you see a patient come as prepared as they could be with the kind of things you're talking about here?
Not as frequently, but I think it's just a new way. I mean, life is a journey, and there are new ways of doing this. Do you remember when we used to use a rotary phone, and now no one has one? And now we have cell phones, and we can watch TV on our cell phones, movies, and all this. Well, this interaction and this engagement with patients and having them take a more active role is a new journey. And in 5 to 10 years, this will be no big deal.
Hey, Dr. Pooh, you mentioned that this patient-centered model is a new thing. Yeah, what other areas do we still have to grow in that, I guess?
I think the main thing we have to grow is from the physician side. The physicians have to buy into the concept, and they have to embrace it. They have to understand, and we as physicians have to know, I mean, that basically we're in this together. I mean, we're spending healthcare dollars like water right now, and we have to find more efficient ways to actually deliver health care, but actually improve outcomes also. And I think there's general consensus basically that the system that we've been operating on for the past several decades, the fee-for-service, where it's based on volume, whatever, is a system probably that's not working anymore. It doesn't. We're not efficient with our healthcare dollars. We're not efficient with the resources that we have. There's overutilization of certain resources, underutilization of others. And basically what's evolved is we're spending more dollars and getting worse outcomes. So what we have to do is reverse that trend, and that's going to take physicians really kind of taking charge and embracing the idea. It's going to take, politicians and whatever to begin to look at better systems on how we reimburse healthcare providers and how we reimburse hospitals, et cetera. It's not based on how many patients I can see or how many patients I treat. It's based more on we actually did something for them. We actually did get them better. So I think it's going to be a combination of a lot of things and a lot of people. And Ingrid's red book, it's kind of the early version of like an EMR, because what's so critically important is just exactly what she talks to, is the communication between providers. That's just as important. If Ingrid sees a heart problem, sends the patient to a cardiologist, that's what happens. The cardiologist says, what medicine are you on? And the patient either brings it or, I know in rural areas, you just have to call the pharmacy or you make your best guess at it. And the next thing you know, everybody's changing their medicines, and the family physician doesn't know what you changed it or why you changed it. The cardiologist, is doing this, that, and everybody's working their own little silo. And I think, EMR is going to help us with that, but it's tools like this that are going to put the patients and the physicians in the best position where there's forced communication between providers, and that that the patient is at the center, and we're all feeding off the same information. And I think that's. But for physicians, it's a big step, particularly for us older physicians like myself. Not Ingrid. But.
Well, we talked. There's a lot about being prepared when you walk in, but we also talked earlier about making sure that patients are asking questions, and what are some examples of questions that patients don't ask that they should be asking that may lead to better health results?
Well, the first thing that comes to my mind, just absolutely, when a doctor is going to write you for a new medication, they never ask, what are the side effects? Is this the only thing I could do? Actually, my primary practice at the beginning was I was a general surgeon, and people would never ask. You would tell them they came in for a hernia, or they had breast cancer, or they had colon cancer, or whatever. You told them what the best choice of therapy was, but very, very few people ever ask. What are my alternatives? What else could I do? They don't do that. They rely that the doctor knows best and whatever. And for the most part, we do. But it's good to ask those kind of questions because you don't want to be thinking, and you want to be focused on, this is the way I'm going, this is why I'm going. It's not just because the doctor told me that. It's because I know I've looked at the other alternatives, and those aren't feasible. This is the way to go. And from my aspect as a surgeon, I would want people to ask more about, what are my options? What are the alternative ways that we could actually take care of this? But from the primary care, I'm not a primary care specialist, but I would say it was probably medications, and they don't ask about the medication; they just take them.
Or you write the script and they don't take them because they have some at home, but it's at a different dose, and they're not sure how to read the bottle. so they don't know that it's a different dose, and so they're taking a smaller dose than they should be, or they have two drugs, one is a brand name and one's a generic name, and they don't know that they're the same drug, and they take them both, which could be very, very dangerous. And these are, and it helps if the patient would always bring all the bottles they have in their house to the doctor, so that we could actually make those clarifications that this brand name and this generic are actually the same drug.
And so it's maybe not just writing, or just writing down the names maybe, right? But it's not even just the names, it's also the dosages, right?
Right, the dosage, but if they can bring the scripts in, bring the bottles in, that's helpful.
Yeah.
Also, another thing is understanding disease processes. For instance, high blood pressure or hypertension. Someone may finally get on some blood pressure medicine, and their blood pressure is fine. It's perfect. It's 120/80. And they're like, oh, I'm done. I don't need to take these medicines anymore. Well, they don't communicate that with the doctor, so they stop taking their medicine, and then they come back and their pressure is really high. Or decisions. How long do I have to take this inhaler for my asthma? How long do I have to take this blood pressure medicine? Can I do some things at home? What about your diet? Are there different things that you're eating that we could help you with so you don't have to take as much, or you could take less, or you could get off of your medication? And those are conversations that patients need to bring up. What about my diet? What about exercise? What about my stress level? Are there some things I can do about my stress? And again, we are not Dr. Spot. We do not know all things. And you have to come and tell us so we can treat you better, and meet your needs.
Yeah, to remind our audience, this is Intersection, a program of KBIA and the Reynolds Journalism Institute. I'm Ryan Famulner, and today on Intersection, we're talking about how to talk to your doctor. The way a patient communicates with their doctor can have a significant impact on diagnosis, treatment options, the ability to avoid medical errors, and ultimately an impact on a patient's health. We're joined by two practicing Missouri doctors who are also board members of Health Literacy Missouri, Dr. Steve Pooh and Dr. Ingrid Taylor. The organization's goal is to help people make smart health decisions. This is a special edition of Intersection from Leadership Auditorium on the University of Missouri campus. This live forum was pre-recorded, so we won't be taking calls this week, but later in the show, our live audience will join in on today's conversation. We'd like to remind you can watch Intersection as streaming video online during our live conversations every Monday afternoon at 2 at kbia.org. You can watch that video and join our online chat by going to kbia.org and scrolling down to the link for Intersection. Again, that's Mondays at 2 online at kbia.org. So there's all this stuff all these information that patients need to be getting from their doctor. Is there a reason, though, that doctors aren't automatically offering that information up? Or I guess the other way to ask is, how do doctors prioritize what they are telling their patients?
Well, like we've talked about previously, I think, when we're in a fee-for-service model, so basically doctors are being paid by volume. And I'm not trying to, badmouth doctors, saying,
Sure.
we just see them, we just treat them and treat them and whatever. You do the best you can with what you have to do.
Sure.
And but I think that the problem is time. It is time. Mm-hmm. As you'd love to spend 20, 30 minutes with every patient, but how many hours are in the day for you to see patients? And are you going to see 30 or are you going to see 10? I mean, those 10 people are going to be real happy, but there are going to be 20 people who are going to be unhappy because you never got to them, or they couldn't make appointments with them. So I think we have to work out a system, not only that, doesn't necessarily reward just volume, but I think we even have to look beyond that too, is in our health system as far as providers go. Frankly, there's a huge shortage of primary care physicians all over the country, and no more acute than in our rural areas. We have to look at innovative ways that we can provide health care to people, and sometimes it's not going to be physicians. And so, or they're going to be rural health clinics or FQHCs or whatever. And you have a limited amount of health care providers, and you've got huge populations. How do you take care of all of them? And I think that's going to be part of the problem too, is having the actual number of providers, not only in urban areas, but in rural areas too, that can provide care for people and spend the type of time that's necessary. But I think we can't overly stress what Ingrid talks about, is if the patients will come more prepared to the physician's office, there's a lot less time wasted. And I think it's some ways it's a cultural thing. I think there's some intimidation about the fact that, physicians were always held at this sort of high esteem, level that, oh, no, I can't question my doctor. But yes, you can. Yes, you can. And, we're just people too, and we do a job. And we can only do our job if you help us do our job. And I think the more we as physicians will take that attitude, the more we'll progress to a more patient-centered model.
Right, because the patients may feel like, yeah, like you're questioning their doctor, which may be disrespectful, or maybe they're wasting their time, something like that, right?
Yes, I think so. I think, I think patients think sometimes when they question their doctor is showing disrespect. It's not. It really isn't. Now, there are some physicians, like you say, they're in a hurry, they have to see, and, somebody stops them and says, well, what about this, or what about this? And the doctor says, well, just take my word for it, this is going to be good, because they're in a hurry. Those things can happen, and that can really discourage a patient. But by the same token, if a physician is not willing to explain things to you, and sit down with you, maybe not that visit, but the next visit, to really explain to you what's going on and put your mind at ease and help you focus on being better, in better health, then, you got a problem.
Dr. Taylor, go ahead.
And I just want to also add about what patients can help doctors with. So one of the things the planner does is it allows you to actually record your labs. So when we send you to different doctors and they get labs, some of those labs don't get back to us. And so now we have EHR, and we may order the repeat lab that you already had. Well, what if you pulled out your lab? So now this is an empowerment. Not only do you get your labs, when you get your blood drawn, ask for a copy of your lab. So that
like a hard copy, a printout, yeah.
So that you can bring it to your doctor, so at least it's not repeated. And that helps us. If you get a study, whatever study, ask for a copy of it and bring it to your primary care doctor's office.
Do patients do that? Patients don't often ask for those?
They don't.
No.
But they may not know that they have the right to
They do.
ask.
They have the right for it.
They have the right to ask for it. And that's key of knowing what the bottom line is your health, is your life. And if a doctor wants you to do plan A, which takes you down road A, and you're uncomfortable with that, that doctor has no idea why you are uncomfortable with it. And unless you speak up, they're going to assume you're continuing down road A and you haven't left the start place.
We're going to have to take a quick break on that thought. This is Intersection, a program of KBIA and the Reynolds Journalism Institute. Today we're talking about how to talk to your doctor. We're joined by Dr. Steve Pooh and Dr. Ingrid Taylor. I'm Ryan Famil, and we'll be right back after this short break. This is Intersection. Welcome back. It's a program of KBIA and the Reynolds Journalism Institute. I'm Ryan Famulner, and today on Intersection we're talking about how to talk to your doctor. The way a patient communicates with their doctor can have a significant impact on diagnosis, treatment options, the ability to avoid medical errors, and ultimately an impact on a patient's health. We're joined by two practicing Missouri doctors who are also board members of Health Literacy Missouri, Dr. Steve Pooh and Dr. Ingrid Taylor. The organization's goal is to help people make smart health decisions. This is a special edition of Intersection from Leadership Auditorium on the University of Missouri campus. This live forum was pre-recorded, so we won't be taking calls this week, but later in the show, our live audience will join in on today's conversation. Today's show was produced in partnership with the KBIA Health and Wealth Desk. So as we went into the break, Dr. Taylor was talking about basically just taking charge as the patient. Dr. Pooh, I think you wanted to follow up a little bit on that.
Yeah, I just wanted to say that, nowadays with technology the way it is, I think patients are going to have a much better opportunity to access information. A lot of health systems now have what we call patient portals, where actually online you can actually obtain your medical records and your information. And I think that's going to empower patients a lot more on getting their medicines, what happened when they were in the hospital, or what's happened here, what's happened there. Because ultimately, we have to use technology as our friend. Because, an example is that if we want to send a package by FedEx to someplace, we could get on the computer and we can see every place where that package is. You go to the doctor and you have a biopsy done. Where is it? You have no clue. You have no way to track it. You have nothing. We have to use technology as our friend. And I think that as we move forward, technology is really going to help us be able to not only improve patients' literacy levels, but we'll also be able to provide them with the information they need to be able to take to their doctor and say, what does this mean? What does this mean?
Yeah.
I agree. And I also will say that you can use your cell phone as a start. I mean, your cell phone can be your alarm for your doctor's appointments. Your cell phone, you can put in your notes, your questions to the doctor so that you can always go to it. In your cell phone, you can put in the answers to all of your questions that you have with the doctor, and that can be your quick initial record as we move toward technology of using the portals and so forth, or having family members help you with the portals if, you're averse to computers. But, you have to look at computers like the rotary phone. We've made those changes, and, it's coming down the line, and
But some hospitals might still kind of be on those rotary phones, right? And maybe in some areas, or close anyway, right?
They are.
Yeah. So, so yeah. Do you think people are maybe too reliant on electronic medical health records? We've been talking a lot throughout the last half hour about that. Are people? What I'm hearing is maybe we're not quite to the point. Those paper records are still going to be better than possibly relying on that when you're going from provider to provider, right? I mean, having those records accumulated yourself.
I think you always should have a backup, personally, on very important things. Women with their mammograms, you need a copy of your records, because you may change your insurance, or you may get a new doctor, and you may have it done at a different facility, and you physically probably need that piece of paper with you. So I think those important things, it's good to get a paper trail.
I agree, because what happens is various physicians' offices, hospitals, whatever, and that's supposed to be the beauty of EMR, is that you can exchange information about people's health information and whatever. But what we find right now is, everybody's on these different EMR systems, and they don't always interface. So just because, you have your records at this hospital, and this hospital, you end up in the ER in this hospital, doesn't mean they can access it. So it's always best to have the backup.
One thing you both have some perspectives on as well, especially you, Dr. Pooh, is about some of the challenges in the rural areas as well, which obviously a lot of our listening area would qualify to be in that type of area. So what are some of the challenges, I guess, especially on this topic of communicating with your doctor, maybe some specific things about rural areas that are a little extra challenging?
I think in rural areas, obviously, there are cultural challenges. There are diverse communities both in urban areas as well as in rural areas. But I think when you look in our rural areas, particularly in our area in the Boot Heel of Missouri, we have high rate of unemployment, we have high rate of poverty there, and basically we have very low literacy levels and very low empowerment there. People there, grew up there, have stayed there, and basically think the same way about a lot of things. And I think that they're very intimidated going into healthcare providers and, asking, why are you doing this or why? And I think that they feel much less empowered than a lot of people in the urban areas. And the other thing down in the rural areas, I think that is really critically hurting us right now is lack of resources to some degree, but also lack of providers. For the number of providers we have in rural areas, I mean, they're having to cover thousands of patients, whereas in urban areas, there's a higher concentration of providers, not only physicians, but mid-levels such as PAs and nurse practitioners. And that is the challenge moving forward for us, is to have more providers down there to be able to really take care of these patients. But the rural area is unique. It's almost a separate culture sometimes, and we have very unique challenges.
Specifically on the educational level challenges in some of these rural areas too, how do you accommodate that as a doctor when we're talking the issues we're talking about here?
I think what we have to do is what we have tried to do here with our organization, Health Literacy Missouri. We actually do trainings, and so we had them come down to our hospital in Kennett, and actually it was a physician from MU here who is a great teacher and educator, and came down and trained us on health literacy techniques, on teach back, on the fact that when you're getting ready to leave the exam room, we typically say, "Do you have any questions?" Well, that's the wrong question to answer, because it's kind of like you're implying, please don't say you have a question. Instead of saying, "Do you have any questions?" you say, "What questions do you have?" That opens it up. It's open-ended, and that's what you want. You want it open-ended so they feel empowered that they can actually ask you a question. And so I think as an organization, we have really tried to touch, more rural areas, community health centers, et cetera, to train providers on how to communicate better with patients by empowering them to get involved in the conversation more. And I know at our facility, we have improved tremendously, as our data shows from our patient satisfaction surveys, that the communication with physicians has improved dramatically over the last 2-3 years since we've had this training. And so I think moving forward, I mean, like we talked from the very beginning, really it starts with the physician. We as physicians have to communicate better. We have to empower patients more. And I think as the leader of the conversation, it's really incumbent on us to be the first one that acts.
What are some of the things that happen at those trainings? I mean, it sounds like what you're saying is, obviously both of you here are very open to getting questions from your patients.
Right.
But there probably are some doctors that aren't, as willing, or maybe what are some of the things you're encountering in these trainings and things that you're teaching these doctors to change their mindsets?
I'll tell you exactly what happens. What they'll say is, "Well, I understand that, and I agree with you. That's the way it ought to be. But I've got 20 in the waiting room. I can't sit in there all that period of time and answer all those questions and do all this, whatever." But what you have to come back is that for every question you don't answer, that's a potential thing that they're going to be back for. That's going to have an adverse effect. So it's better to answer it then and get it taken care of then, so it doesn't come back to haunt you later.
I agree. And I also say, again, patients can help doctors do a better job. And so I would encourage all patients, before the doctor walks out the door, say, "Doctor so-and-so, at our visit, this is what we're going to do. This to take care of my problem. Is that correct?" If you just if you could just verbalize or summarize the visit in front of the doctor before they leave, that helps the doctor make sure that he communicated or she communicated correctly, and that you understand what the plan is. Because one of the frustrating things that happens to me as a primary care physician, when I send a patient to a specialist and the patient comes back, and I say, "Well, what happened at the visit?" And they say, "Well, that doctor didn't do anything for me." Or, "That doctor didn't say anything to me." Well, I know that didn't happen, but what I do know is that probably the communication was not good at all. So always remember, when it doesn't feel comfortable, that's actually your time on stage to help us do a better job by saying, "Okay, let me get this straight. This is what you want me to do about this problem. Is that correct?"
Yeah, and that's
Yes, no,
yeah.
maybe.
And maybe you missed something,
Right.
and then the doctor knows, "Oh no, here's this other thing I forgot to tell you about."
Right.
Yeah. Do either of you have examples of times where there's been a patient that's asked a question that has resulted in a better outcome? Like when you're at that point and someone is saying, "Okay, I'm ready to walk out the door. Oh wait, one more question," and it actually, improved their safety maybe, or something like that. I mean, what are examples, hard examples of a question that could lead to a better result?
Well, a number of times, I think the wonderful thing about being a family physician is that you get to see the patients over and over again, and you do form a relationship. And sometimes it may take a minute to figure out that the patient is actually very depressed. And when you're depressed, you don't hear things as well. You're more isolated. And you're less likely to be compliant or follow through with an action plan because you're very depressed. Sometimes people can get so depressed they can't even get out of bed. And it may take a while for a patient to divulge the challenges that they may be having. So I've found a number of times when a patient is not following an action plan or a diet or an exercise, I need to step back and see if there are any social issues going on that inhibit them from supporting that plan. And there are sometimes depression. And when we can get the depression under control and the patient feels better about themselves and their environment, if we can have the social worker deal with some of the social needs, then when they come back, they're more compliant with their diabetes regimen, their high blood pressure regimen, their chronic emphysema regimen. It's amazing. But the big elephant in the room was an emotional challenge that hadn't been addressed, which was depression.
I agree. And that's, unfortunately, what's a little bit maybe off the subject, but mental health needs are so often ignored. Mm-hmm. And because we just don't ask.
And it does take time too, right?
It does take time. But this was basically a situation that happened to a colleague of mine. You know, he's an internist. He's making rounds for one of his partners. And he's going around making rounds, and he comes to a patient who's had an operation about 5 days previously, had part of his colon removed. And everything, his vital signs look good, his lab work looks good, you know, he's up, walking, he's eating a regular diet and everything. And, you know, he thinks, well, this guy's ready to go home, everything's good. And so he's just about ready to discharge the patient. And he decides, I'm going to ask one more question. And so he says, is there anything that you're worried about going home? And it opened it up. He said, yes, I just found out that growth in my colon was cancer. What am I going to do? If he would have not asked that last question and just gone on, he'd have sent this guy home, and he would have wondered, well, what do I do next? Mm-hmm. What am I going to do next? And so I think that, you know, the patients do have to help us sometimes. And, you know, if there's a question in their mind that's not answered, they need to ask it. And we can obviously do better to provide that opportunity with the open-ended question like I talked about previously. What questions do you have? But I think it's a two-way street. You know, it's a learning experience for both of us. Mm-hmm. But I think we both need to get better.
I need to remind our audience, this is Intersection, a program of KBIA and the Reynolds Journalism Institute. I'm Ryan Famulner, and today on Intersection, we're talking about how to talk to your doctor. The way a patient communicates with their doctor can have a significant impact on diagnosis, treatment options, the ability to avoid medical errors, and ultimately an impact on a patient's health. We're joined by two practicing Missouri doctors who are also board members of Health Literacy Missouri, Dr. Steve Pooh and Dr. Ingrid Taylor. The organization's goal is to help people make smart health decisions. This is a special edition of Intersection from Leadership Auditorium on the University of Missouri campus. This live forum was pre-recorded, so we won't be taking calls this week. But we are going to take some questions from people in our audience, which we have a couple of those. We're going to go to those now. One of our producers, Hope Kerwin, had one of the questions I believe that was submitted from one of our audience members today. Hope?
Yep. Our first question is, how do you ask your doctor about a condition you might have that's embarrassing?
Any advice on that?
That's a tough one. But everybody has to realize that the doctor-patient relationship is sacred. You know, what you say to your physician is sacred. It cannot be shared with anybody else, or it's not public knowledge or whatever. So you need to be open. The other thing too is if you want a physician to help you, you have to be open. You have to tell him or her everything that's bothering you, and no matter how embarrassing it can be. But I know it's a big barrier to overcome at times.
I would also say try and make that doctor visit as comfortable for you as possible. So if you have a concern that's embarrassing, and let's say your husband may bring you in and you don't necessarily want to disclose that, you may want to say to the nurse before they bring you in the room, I really want this to be a one-on-one conversation between me and my doctor. You can, if there's someone who would make you feel more comfortable with talking about something that's embarrassing, bring that person to the clinic visit. If you feel uncomfortable about talking about a topic, it's okay to say, doctor, there is something I need to talk to you about, but I've been struggling with it. That just changes the tone immediately, you know. And so then the doctor is trying to figure out, how do I make this environment as comfortable for you as possible so you disclose what the problem is. But if you're uncomfortable with it, it's good. Just say, I'm uncomfortable with it, but I need to talk to you about it, and that will help a lot.
Okay. Was there anyone else that had a question? We've got one up here, up front.
You had referenced a red book there for records and other stuff. Is that available somewhere? Where'd that thing come from?
It is online on www.alliesinhealth.com. I have an online store that you can purchase it there.
It's called My Health Companion.
My Health Companion.
Right. Oh, we've got a question over here.
This isn't completely a fair question because I've worked as a mid-level practitioner in an emergency room and also in a primary care clinic. But I was wondering if you had one question that you would want the patient to ask before the end of your visit with them. If we could seed a question with every patient, what would it be? And of course, I have a candidate question, but I'd like to hear from you.
That is a good question. I'll have to give that some thought. But I think it would have to be a question along the line of somehow the patient asking the physician, please summarize everything for me in a concise, plain language paragraph where I understand what happened just now today with this encounter. Summarize it for me, what actually happened.
I would agree with that, and I would also add, if the patient has heard the action plan and is uncomfortable with it, the one question I would want after every visit is, Dr. Taylor, I am uncomfortable with this plan because of this, so that I can help them champion a plan that would work best for them.
What was yours? Yes.
I would just want to add what my question was. It's, what can I expect? What can I expect from the course of the disease? What can I expect from these particular medications? What can I expect in terms of the healing? Because I found that a lot of people bounced back much too quickly because they really didn't understand what they should be expecting in the course of the illness or the recovery from the illness. And if they just understood that, so what can I expect being on the back of the door before people leave might help.
It's a good question.
I think we have, if there's anyone else, we have a question on paper. Maureen Lewis-Stump, another one of our producers. Maureen, what was that question from another audience member?
How do you get a loved one to see the doctor when they won't or they refuse to go?
Ooh. I tell you what, we see this a lot. Obviously, we see this a lot in I'm sure you too, but in rural areas you see this a lot. People hesitant to go to the doctor for whatever reason, whether it be cost, intimidation, is it going to hurt, or whatever. But I think it goes back to part of what we're charged to do as physicians, as healthcare providers. And part of what we have to do is education. And I think that we as physicians probably really need to do more community education. I think if you go to venues where you can actually talk to people in general, not specifically, and they will identify with certain things and certain things that you talk about and certain disorders that you talk about, hopefully that will empower, no, it's not so bad. I can go to the doctor and talk to him about this or her about this, and there are things that can be done to, help me with this. But I think it comes down to education. And once again, education has to be at the level people understand. And as we alluded to at the very beginning, even the most intelligent people, when it comes to health, are about at a 5th grade level. So you have to, when you educate, you have to be at that level.
I would also say that to that person who asked the question is to really try to identify why that person doesn't want to come to the doctor. I mean, I could hypothesize a whole list of reasons of why that person may not want to see a particular doctor and could be completely wrong. And then try to meet them at that level. If it is because I don't have any problems, I feel good right now, and if I go to the doctor, he's going to find out something that I don't already know I have, and I don't want to take any medicine, so therefore I just think I want to stay at home. I mean, that could be it. I mean, maybe not. Then the counteract is for a family member that person trusts to say, standard of care is a yearly exam. This is standard of care, and so just a yearly physical is just standard. So why don't I go with you? I'll make sure the doctor doesn't do anything harmful to you. I'll ask the questions that you might want to ask but are too scared. I'll be your anchor. Again, you guys can help us. And that may facilitate that person coming. And there are also some doctors, not many, but some, and they're becoming more and more, who actually do house calls. So again, you don't, and that's a matter of actually calling the clinic or the doctor you see and ask them, do they do house calls or do they know a physician who does it? So that's coming back around too. So
I want to take a moment to remind our audience, listening audience, if anyone else in the audience has a question, flag down one of our producers. But this is Intersection, a program of KBIA and the Reynolds Journalism Institute. I'm Ryan Famulner, and today we're talking about how to talk to your doctor. We're joined by 2 practicing Missouri doctors who are also board members of Health Literacy Missouri, Dr. Steve Pooh and Dr. Ingrid Taylor. The organization's goal is to help people make smart health decisions. This is a special edition of Intersection from Leadership Auditorium on the University of Missouri campus. This live forum was pre-recorded, so we won't be taking any calls this week, but we have been taking some questions from our audience here. So one other question we did have from someone before the show emailed us this question was about immigrant patients and their communication with their physicians. What are some of the challenges there and methods that can improve that?
And this is all part of health literacy too. It's all kind of rolled health literacy and what we call cultural competence. And we actually have a board member at Health Literacy of Missouri who is an expert in cultural competency. But it's a very big issue now, particularly in both urban and rural areas. We have a very diverse population now, and it's not just language. It's truly cultures that you have to deal with and that you have to understand, and you have to adapt not only your conversations, but your treatment plans according to what their culture permits or what their culture wants. And it's another evolving arm of health literacy, and it's a great challenge moving forward.
I worked in a facility where it was not uncommon to experience 5 different languages in a day, but this facility actually had 5 different interpreters from different cultures. And so one of the things is the training on the physician on how to use an interpreter correctly, and to also be cognizant of whether or not the interpreter is clearly communicating your plan in the terms to another person is a challenge. And then also for physicians is how you express an illness. It means different things in different cultures, and to be aware of that. And when I think about English as a second language, and I think about the Latino population, and I even think about how things are written on bottles. For instance, it may say, take a pill once a day. Well, once is O-N-C-E. Well, that's once, so you have to, sometimes the words can be different, and so you have to make sure that you don't tell a patient to take more medicine than what they're supposed to be taking, and that you are specific on how you write your prescriptions out.
And I think, we are actually have been trying to assist an organization out in California that deals with a population of Pacific Islanders where they're a very, very small group and they have their own dialect. So there's absolutely no written material in their dialect. Now, how can you communicate with those folks and whatever? And what we're looking at right now is how we can use pictures to communicate better with people where you don't have written material and there's no way to communicate. You don't necessarily have interpreters. How we can use pictures to actually communicate with people.
Well, we're going to have to end it there because that's all the time that we have for today's Intersection, a special edition from Leadership Auditorium on the University of Missouri campus. Thanks to our guests, Dr. Steve Koo and Dr. Ingrid Taylor. They're both practicing Missouri doctors who are also board members of Health Literacy Missouri. And thanks to all of you here in our live audience who joined us for the forum today and asked some great questions. We'd like to remind those of you enjoying this as a rebroadcast. The Intersection takes place live for a full hour from 2 to 3 every Monday afternoon. You can watch live streaming and video of our program each Monday afternoon online at kbia.org. Alongside that video, you can submit your questions and comments and take part in an online discussion with others in the audience. You'll also find an archive of all our past programs, including the full hour of today's conversation. Intersections is a broadcast from the Reynolds Journalism Institute and is a project of RJI and KBIA. Today's show was produced in partnership with the KBIA Health and Wealth Desk. This episode was produced by Katie Heiler. Travis McMillan's our technical director with production assistance from Janet Saidi, Marlene Stump, and Hope Kerwin, and Lowell Thomas. Thanks for listening today. I'm Ryan from Muehlner. Have a great week.